Have you ever heard of HPV? Maybe yes, maybe no. But what you might not know is that this silent and extremely common virus can be the trigger for one of the greatest enemies to your health, cancer. And the scariest part is that it might already be in your body or in the body of someone you love, acting silently, without any apparent symptoms, while slowly progressing, cell by cell. In this video, we're going to show you the real and direct connection between HPV and different types of cancer, such as cervical, throat, anal, and penile cancer. You'll understand why this relationship is so dangerous, how the virus operates invisibly, and most importantly, what you can do right now to protect yourself. This information could save your life and the life of someone close to you. Watch until the end. The information you're about to hear can literally save lives. The human papillomavirus, or simply HPV, is one of the most common sexually transmitted viruses in the world. It's estimated that over 80% of sexually active people will come into contact with the virus at some point in their lives. It is mainly transmitted through direct contact with infected skin or mucous membranes, which includes sexual intercourse with or without penetration, and also oral genital contact. What makes HPV so dangerous is that, in most cases, it shows no symptoms. You can be infected, transmit the virus to others, and carry on with your life normally, never imagining that inside your body, an infection is about to trigger something far more serious. There are more than 100 different types of HPV, but about 14 of them are considered high-risk oncogenic strains, meaning they have the potential to cause cancer. Types 16 and 18, for instance, are responsible for about 70% of cervical cancer cases. But the threat doesn't stop there. HPV is also behind a large number of throat, anal, penile, and vulvar cancer cases. The connection between the virus and these cancers is scientifically proven, and the process is devastating. HPV enters the cells, alters their DNA, and transforms them into precancerous cells that can evolve into malignant tumors over the years. All of this happens without pain, without fever, without signs. And now you might be wondering, if the virus is that serious, why is it still so widely ignored? The answer is simple and concerning, because it gives no warning. HPV can remain in the body for years without causing any visible discomfort. In some cases, the immune system is able to eliminate the virus naturally. But in others, especially when there's no regular medical follow-up, it stays there, acting discreetly. By the time symptoms finally appear, they may already indicate the presence of precancerous lesions or even cancer at an advanced stage. That's why HPV is called the invisible enemy. It doesn't shout. It whispers. The good news is that there is prevention, there are solutions, and there is real protection available, and it's closer than you think. The HPV vaccine is safe, effective, and offered free of charge by the public health system to boys and girls aged 9 to 14. This is the ideal window for immunization, before the start of sexual activity. But if you're older than that, you can still get the vaccine at private clinics or talk to your doctor about getting immunized. The vaccine directly targets the most dangerous types of the virus, preventing them from even entering your body. It also helps break the chain of transmission, protecting not only you but everyone around you. And prevention doesn't stop there. For women, the Pap smear is a powerful and indispensable tool. It can detect changes in cervical cells before they turn into cancer. It's quick, simple, and available for free at public health centers. Even so, many women skip the exam due to fear, embarrassment, or misinformation. But the reality is clear. Those who regularly undergo Pap smears drastically reduce their risk of developing cervical cancer. And the earlier the lesion is detected, the more effective the treatment and the greater the chance of a complete cure. To help you understand the importance of prevention, imagine Carla's story, a 42-year-old woman, mother of 2, who went nearly a decade without seeing a gynecologist. She felt healthy, had no apparent symptoms, and believed there was no reason for concern. Until one day, unexpected bleeding led her to seek medical attention. The diagnosis: advanced cervical cancer caused by an old and silent HPV infection. If Carla had undergone routine exams regularly, the virus could have been detected earlier, and the disease's progression might have been prevented. That is the difference between taking action and waiting. And don't think this is only a women's issue. Men are also affected by HPV, and significantly so. Even though they don't have an equivalent test to the Pap smear, they can develop genital warts, penile, anal, and throat cancer, especially when the virus remains in the body for long periods. Male vaccination is essential to break the cycle of transmission and protect the entire population. Yet, many men don't even know they can, and should, be vaccinated. That has to change. Information saves lives. Prevention protects. And health is built with awareness, not luck. While most public campaigns focus on women, rightfully so, given how deadly cervical cancer can be, it's crucial to understand that men also carry significant risks. HPV can cause penile, anal, and throat cancer in men, especially types 16 and 18, which are among the most aggressive. Since there are no equivalent screening tests for men, vaccination becomes even more vital. Many men have never even heard about the importance of getting vaccinated against HPV. Moreover, since many infections are asymptomatic, men can unknowingly carry the virus for years, transmitting it to their partners. This neglect helps perpetuate the cycle of transmission. Including men in prevention campaigns is a critical step to protect all of society. And for parents with boys aged 9 to 14, now is the time to act. Vaccinating today means preventing cancer tomorrow. It's not just about self-care, it's about collective responsibility for public health. Let's understand how HPV, an apparently harmless virus, can become so dangerous inside our bodies. After infection, it settles in the cells of the skin or mucous membranes, especially in genital and oral areas. In many cases, the immune system eliminates the virus naturally within 2 years. But when it remains active longer, it can alter the DNA of infected cells, directly interfering with the mechanisms that control cell multiplication. The result is the development of lesions known as dysplasias, early, precancerous changes. Over time, these dysplasias can progress and become malignant tumors. The most alarming part is that this entire process is completely silent. The person continues living normally, believing they're healthy, while their cellular structure is being corrupted. That's why early detection of these changes is vital. The Pap smear identifies exactly these dysplasias before they evolve. Understanding this progression is what allows us to stop it in time. Scientific information saves lives, especially when applied responsibly. Many parents find it difficult to talk about sexuality and prevention with their children. But when it comes to HPV, silence can be costly. The best time for vaccination is between ages 9 and 14, the age group in which the vaccine is most effective. And it's during this period that doubts, fears, and taboos often arise. As parents, it's our duty to provide clear information, without judgment or shame. Explain that the HPV vaccine is like any other, a form of protection. Don't promote fear. Promote prevention. Show that talking about health is an act of love, not punishment. Use simple language, be direct, and offer practical examples. Emphasize that everyone, boys and girls, should protect themselves. And if you, as an adult, don't yet have all the answers, seek out reliable, up-to-date information. Educating is protecting. And starting that conversation at home can be the first step in saving lives, even before your children realize it. If there's an exam that saves thousands of lives every year, it's the Pap smear. It detects changes in cervical cells before they become cancerous, with impressive preventive effectiveness. Still, millions of women skip it due to fear, shame, or misinformation. The procedure is quick, usually painless, and available for free at public health facilities. When done regularly, it can identify the dysplasias caused by HPV and allow treatment to begin before things worsen. It's recommended for women between 25 and 64 years old, ideally every 3 years after 2 consecutive normal annual exams. Skipping the Pap smear is like walking in the dark. Taking it is like turning on a light that may reveal a problem before it becomes unmanageable. Taking care of your body is a right, not a taboo. And the more we normalize this conversation, the more women will have the chance to prevent a disease that, in many cases, could be avoided with a simple test. HPV is not just an individual problem. It's a public health issue. It affects millions of people every year, places a burden on the healthcare system with expensive and invasive treatments, and impacts entire families. Prevention is far cheaper and more humane than treating cancer. When people get vaccinated, they break the chain of transmission. When they undergo preventive exams, they reduce the number of severe cases. When they share reliable information, they save lives around them. The responsibility for prevention isn't just for those already sick, it belongs to all of us. The more people get vaccinated, the less the virus circulates. The more exams are done, the earlier problems are found. Silence protects the virus. Information protects you. And collective awareness protects the future. It's not enough to just care for yourself. We must act together. HPV prevention doesn't begin at the doctor's office. It begins at home, in schools, in everyday conversations. And it begins now. By now, you might be wondering what you should do. And the answer is simple: take action today. If you're a woman and it's been more than a year since your last pap smear, schedule one. If you have children in the right age group, get them vaccinated. If you're a man and you've never spoken to a doctor about HPV, it's time to change that. Spread this information. Share this video with people you care about. Prevention only works when it's done with awareness, and it starts with the first step. You can't see HPV. You can't feel it, but it might be acting inside your body. What you can do, starting now, is stop it from continuing. And for that, you only need two things: knowledge and action. Don't wait for silence to turn into a diagnosis. Use this information as a vaccine against ignorance, against fear, and in favor of life.